Welcome back to the Best PT Podcast. This is bonus episode 6, talking all about clinical prediction rules, or CPRs. The first CPR is the Canadian Cervical Spine Rule. So the conditions for this rule are that it determines the need for radiographs for the patient. However, the patient must be alert, so a Glasgow Coma Scale score of 15, and the patient must be in stable condition. So the rule: if the patient is greater than or equal to 65 years old, had a dangerous mechanism of injury, or has paresthesias in the extremities, then yes, they need a radiograph. And here, a dangerous mechanism of injury is defined as a fall from 5 or more feet high, 3 stairs, an axial load to the head, involvement in a high-speed collision, rollover or ejection, hit while riding a motorcycle or bicycle. The next rule is a safe assessment of the range of motion possible? If the answer is no, then they need a radiograph. So here, safe assessment assumes that they were involved in a simple rear-end motor vehicle accident. They had no contact with oncoming traffic. They were hit by a similar-sized vehicle. There was no rollover, and that it was overall a low-speed collision. In addition, they should be able to sit upright in the emergency department. They should be able to walk, either walk in or walk in the emergency department. Experience a delayed onset of neck pain, so no immediate acute neck pain, and they should have an absence of midline cervical spine tenderness. And finally, they do not need a radiograph if they have at least 45 degrees of cervical rotation bilaterally. Moving on to the carpal tunnel syndrome CPR, the 5 variables involved in this are that shaking of the hands relieves their symptoms. Their wrist ratio is greater than 0.67, where the wrist ratio is measured as the anterior-posterior to medial-lateral width at the distal wrist crease. They report more than a 1.9 on the symptom severity scale. They experience diminished sensation in the thumb, and they are 45 years of age or older. The psychometrics here generally become less sensitive and more specific the more items are positive. So with 3 positive, 98% sensitive, 54% specific. 4 positive, 77% sensitive, 83% specific. And with all 5 positive, becomes very specific at 99%, with 18% sensitive. The cervical radiculopathy CPR. So the variables here are that they have a positive upper limb tension test A. They have less than 60 degrees of symptomatic side cervical rotation. They have a positive neck distraction or traction test, and they have a positive Sperling's A test. So as with the carpal tunnel CPR, the more variables positive here, the less sensitive and more specific it gets. With 2 variables positive, 39% sensitive, 56% specific. 3 variables positive, 39% sensitive, 94% specific, and with all 4 variables positive, 24% sensitive, 99% specific. The cervical thrust manipulation CPR, the 4 variables here are that the symptom duration is less than 38 days. They have a positive belief that thrust manipulation will help. They have a side-to-side difference in cervical rotation of greater than or equal to 10 degrees, and they have pain with posterior-anterior spring testing of the mid-cervical spine. The psychometrics here, with 3 variables positive, 81% sensitive, 84% specific, and with 4 variables positive, 50% sensitive, but 100% specific. The meniscus pathology CPR, the 5 variables here, a history of knee catching or locking, knee joint line tenderness, pain with forced hyperextension or the bounce test, pain with maximal knee flexion, passive range of motion, and pain or clicking with McMurray's test. Psychometrics, more than 3 variables positive, 0.308 sensitive, 0.902 specific, 0.1686 sensitive with 4 variables, with the specificity jumping to 0.961, and with all 5 variables positive, 0.112 sensitive, 99% specific. The Ottawa ankle rules. So the conditions here are that the purpose is to rule in or out the need for radiograph due to ankle fracture. You should know that less than 15% of all ankle injuries involve an actual fracture. An ankle x-ray is indicated if there is pain in both malleoli and zones A, B, or E, which we'll discuss in a moment. And a foot x-ray is indicated if there's pain in the midfoot and zones C, D, or E. So zone A is bony tenderness along the distal 6 centimeters of the posterior fibula or tip of the lateral malleolus. Zone B is bony tenderness along the distal 6 centimeters of the posterior edge of the tibia or tip of the medial malleolus. Zone C, bony tenderness at the base of the 5th metatarsal. Zone D, bony tenderness at the navicular. And Zone E, inability to weight bear immediately after injury and for 4 steps during an evaluation. The Ottawa knee rules, similar to the ankle rules, the condition is to rule in or out the need for radiographs for knee fractures. And you should know here that 92% of injuries do not involve a fracture, so about 8%, so even less than ankle. The variables here: age greater than 55, isolated patellar tenderness without other bony tenderness, tenderness of the fibular head, inability to flex knee to at least 90 degrees, and inability to bear weight immediately after the injury or for 4 steps in the emergency department for evaluation. And the caveat here is that limping is allowed. So some limping due to pain is allowed as long as they can still bear weight and kind of limp or drag the injured leg along. The Pittsburgh knee rules are to rule in or out the need for radiograph for knee fractures. And again, 92% of all knee injuries do not involve a fracture. The variables here are slightly different. If the age is less than 12 or greater than 50, they should have a radiograph, and if they cannot walk for 4 steps. So a lot more simple than the Ottawa rules. The traction for neck pain CPR. The 5 variables here are that there is a peripheralization of pain with C4 to C7 mobility assessment. They have a positive shoulder abduction test. They are 55 years of age or older. They have a positive upper limb tension test A, and they have a positive neck distraction or traction test. The psychometrics here: 1 variable or more, 7% sensitive, 97% specific; 2 variables or more, 30% sensitive, 97% specific; 3 variables or more, 63% sensitive, 87% specific; and 4 variables or more, 30% sensitive, 100% specific. The hip mobilization for knee OA CPR, 5 variables here: hip groin pain or paresthesia, ipsilateral anterior thigh pain, passive knee flexion less than 122 degrees, passive hip internal rotation less than 17 degrees, and pain with hip traction. So that's something that's really rare. A lot of people with knee, hip, and back pain, their pain will be relieved by traction. So that variable alone is 98% specific on its own. The lumbar stabilization CPR breaks lumbar or low back pain into 2 different groups. A success stabilization group, they have a greater than 50% increase on the Oswestry Disability Index or ODI. And the improvement stabilization group, who had less than a 50% increase on the ODI. So with the success group, their variables were that they were less than 40 years old, they had a straight leg raise greater than 91 degrees, they had aberrant motions present in their lumbar spine, and they had a positive prone instability test. The improvement group, their variables on the FABQ, the Fear Avoidance Belief Questionnaire, they scored at 9 points or higher. But they had no aberrant movements, they had no lumbar hypermobility with PA testing, and they had a negative prone instability test. So that's all the current and well-established CPRs. As always, the outline will be in the show notes. Thanks for joining me.